What's up, player? I am the Hood Doctor. Very good to see you. I believe I've seen you before, haven't I? Yes, I think we did a dentist appointment together, didn't we? Hell yeah, I remember. You tipped me. You are always welcome back. Always welcome back. So, how can I help you today? You bumped your head. How did you bump your head? You don't need to go into specifics, but just give me a rough idea. You were trapping on the block and someone hit you over the head. Someone hit you on the head. What the heck? Why would that happen? You were trapping on someone else's block. I see. Pushing into turf you shouldn't have been in. That's very naughty indeed. I think you're lucky, actually, that you only got hit over the head. Well, that's okay. You've come to the right place. The Hood Doctor can make sure that you don't have any brain damage, okay? And that's what we want, okay? We gotta keep all our brain cells, all 2 of them, okay? So, let's begin. Today actually calls for a cranial nerve exam to make sure that your brain hasn't sustained damage, okay? So, the first thing I need to do, I need to put on some gloves. Okay, let's keep this sanitary. Let's be professional, shall we? One moment. Okay, let's put these on. 1 second. Rip the glove a little bit there, but I'm not going to replace it. Okay, it's good enough. And I'm not made of money. I haven't got a million gloves lying around, okay? Okay, I'm nice and gloved up now. Now, the first thing we need to do is we need to test your sense of smell. Can you still smell things? Okay, luckily for you, I've got 3 bottles of different smells for you to sniff. Okay, so let's do that. Okay, this is quite self-explanatory. I think you will agree. What I'm going to do is I'm going to give you this to have a little sniff of. Sniff. Okay, and what do you think that smells like? Garlic. Yes, very good. Well done. Okay, off to a good start. Let's do all 3 though to make sure that your sense of smell is still working. Okay. Scent number 2. Okay, scent number 2. If you could smell that for me, please. Okay, very good. And what do you think that one smells like? Cheddar cheese. Excellent. Right, and let's go for the 3rd and the final scent, shall we? 3rd and the final scent. Okay, now, what does that smell like? It smells like Mary Jane. Correct. Excellent. You did very well there. Very well indeed. Okay, before we go any further, I do need to write down your results as we go along, okay, so I don't forget. Otherwise, this whole thing is pointless, isn't it? Right. So, I'm just going to get a pen. And I'm just going to write down the results of your smell test, okay? last time. Except this time you're going to be tasting instead of smelling. Okay, so put your tongue out for me. Very good, there we go. Put a little droplet on there, little droplet. Okay, and now, can you tell me please, what does that taste like? Yes. Orange, very good. Okay, now let's do all three. Okay, let's be professional here. I might be the hood doctor, but I'm a professional hood doctor, okay? Professional. Okay, let's have a little bit of this, shall we? Stick the tongue out again. Very good, there we go, little droplet, little droplet. And now, what does that taste like? Coconut, that's correct. It tastes like coconut. 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 Very good. Good job. Okay, let's do the final taste. Okay, let's see. Right, prepare your tongue. Very good. Do a little droplet, 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 droplet. And what does that taste like? It tastes like the bitter taste of defeat. Correct, correct. Well done. Okay, so it looks like a couple more notes. It looks like you can smell and you can taste. So we're off to a very good start. Excellent there, excellent. Right, now what do we need to do next? What do we need to do next? I think we should start to examine your eyesight. Let's see if you can still see. Okay, now I do believe I have an eye chart that we can go through together. Very professional. Let's go. I like the sound. Nice, isn't it? Okay, now then, stay where you are. Don't come closer. Don't come closer, mate, because you'll be cheating. And also don't go further away, because the results will not be reliable then. Okay, let's be professional. Now then, I'm going to point to letters. You're going to tell me what the letter is. Okay, quite simple, quite simple. Now then, what is this? Good. 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 Okay, good. A bit difficult this one, is it? This whole line, a bit difficult. What about this letter? Okay, okay. And can you tell me, what is this colour here? Red. What about this colour? Green. Okay, good. You aren't colourblind and you can see somewhat. Now, can you cover one eye for me, please? I'll just do a few random letters, not the whole chart. That's boring, isn't it? Okay, a few random letters. Now, what's that letter? Good. 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 And can you see this? Okay, now cover the other eye for me, please, and we shall do a few more random letters. A few more random letters. Good. 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 Okay, okay, you can uncover your eyes now. You can see. Okay, that's very good actually. That's very good indeed. Let me just write that down. Write that down, okay. respond and change to things. And I need to look at the whites of your eyes as well. Very important, very important. Okay, so what I would like you to do, please, is I would like you to look at my nose, or I suppose where my nose would be if I wasn't wearing a balaclava. Okay, and just continue to stare at my nose whilst I look at your eyes, okay? And this might get quite bright at times, but you know, come on now, you're a big bad individual, aren't you? You're not going to get defeated by a little bit of light in your eyes, are you? No. Bit of light in your eyes, absolutely nothing in comparison to what you have to deal with on a day-to-day basis. Very good job. Keep just staring at my nose. Okay, and I'm just having a little bit of a look in your eyes. Interesting, that's quite interesting. Let me just check the other eye as well. Okay, that is interesting indeed. One moment, whilst I think. One moment. Let me use my little brain for a second. Okay, right. Let me just look a bit more closely at your individual eyes. So now I'm going to cover your eyes with my hand. Okay, just the one eye at a time. Okay, so there we go. Cover the one eye there. And now I just want to very quickly observe what happens when I do a little bit of this, a little bit of shining the light in one eye at a time, you know. Yes, very interesting response. Very interesting response. Let's do the other eye, shall we? Let me just cover up your eye there. Half the eye, one eye, yes, that's half of two. Let's have a little look, shall we? Oh, interesting. Interesting response. Your pupils getting quite large, quite small, quite large, quite small. You haven't been smoking anything, have you? You're not on drugs right now, are you? Okay, good, because that would affect your pupils. I should have asked that before. Okay, but good. No drugs, not today. Okay, well that's good then. That's good. Let's see now. Right, what do I want to do with you next? Okay, I think I want to see if you are experiencing double vision. Okay, so what I need you to do, focus your eyes on my finger. This one here, okay? Wiggle. Okay, now it's going to move closer to you. Keep focusing on it. Okay, are you focused on it? Very good. And now we're going to move further away. Now, how many fingers do you see? Just the one finger. That is correct. That's good. That's how it should be. What about now, though, when it's really close? Can you still only see one finger? Yes, okay, excellent. That's a good sign. Okay, no double vision for you. Very good. That's what we like. Okay, going back to utilizing my light. This time I want you to keep your head still for me. Imagine that you're a statue, okay? You're a statue. Perfectly still statue. And I'm gonna shine the light and you're going to follow it with just your eyes, okay? So just only moving your eyes, not your actual head. Understand? Yeah, just like that. Very good. Perfect. Okay, so follow the light for me. Follow the light with your eyes. Very good. Are you experiencing any pain or discomfort there? Pain or discomfort whilst following the light? No pain or discomfort. Okay, very good. Excellent job there. Excellent job indeed. apologies for the noise in the background. I think this neighbourhood is a bit bad, a bit rough, full of criminals. You know, who can say what type of individuals live in this area? Right, but let us continue with the cranial nerve exam. What do I need to do with you next? Actually, let me write down the results. Of what we just got. Okay, important information I'm gathering on your health right now. Important information. Okay. Brilliant. You're doing very well so far. I think no brain damage, okay? But who knows, we've still got quite a few little tests to do, to check, okay? Now, the next thing I would like to do is I would like you actually to look up for me, okay? Just look up for me. Very good. Now, what I'm going to do is I'm going to test your little reflexes of your eyes. Don't worry, I'm not going to actually touch your eyeball, but I am going to touch just around the eye, just here. Okay, interesting. I need to do that again with the other eye. Okay, continue to look up for me, please. Continue to look up. And don't worry about the pen. Don't worry about the pen as it approaches your eye. Okay, good. I'm just looking for the reflexive response there, and I saw it on both eyes, so that's excellent. That is excellent. Okay, what was the next thing I wanted to do with you? That's right. I want you to close your eyes for me, please. Close your eyes. No cheating, no peeping, okay? Otherwise, I'll give you a slap, okay? I'll give you a slap if you cheat. This is important medical test. Now, keeping your eyes closed, I want you to tell me when you can feel something. I'm going to poke you on the face with the pen, random locations, okay? Here we go. Good. 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 Okay, now I'm going to be doing something slightly different. I'm going to poke you with either the point of the pen, which should feel a little bit sharp, or I'm going to poke you with the butt of the pen, okay? And that should feel blunt or soft. Okay, so if you could tell me sharp or soft, depending on which side you feel, okay? Keep your eyes closed. Keep your eyes closed. Here we go. Sharp or soft? Good. Sharp or soft? Good. Sharp or soft? Good. Sharp or soft? Good. Sharp or soft? Excellent job there. Excellent job. Okay, you did very well there. Actually, let me just write that down as well, okay, on my clipboard. Okay. Did very well there. Important note. Important. Okay. Now then, let me see. What else? What else do I need to do with you? Okay. Yes, I do believe it is time to test your peripheral vision. Okay. So I need to focus on my nose, or this little area here. Okay. Keep your head still. Focus on the nose. Now I'm gonna move my fingers. Okay. And I want you to tell me when you can no longer see my fingers. Okay. Good. Now let's keep going. Let's keep doing that. important, medically speaking. Okay, so first thing I need you to do is I need you to puff out your cheeks for me as much as you can. Good, and now I need you to suck in your cheeks as much as you can. Good, now a giant grin if possible. Very good. Now I want you to frown as if you're angry and you hate me. Okay, good. Now raise your left eyebrow. Now raise your right eyebrow. Okay, a bit difficult there. Okay, that's no problem. Now close both your eyes, shut them as tight as you can, please, as tight as you can. Good. Now wink at me with your left eye, okay? Good. Now wink at me with your right eye. Good. Okay, now what else is there? Let me just think. Okay, yes. Can you open your mouth as wide as you can for me, please? Okay, good. Now stick your tongue out. Raise your tongue up for me, please. Good. Lower your tongue for me, please. Good. Tongue to the side for me, please. Good. Tongue to the other side for me, please. Good. Can you touch your nose with your tongue? Okay, not quite. That's okay. Okay. Put the tongue back in now. Very good. I think that's everything there. Now, I do want to look in your mouth a little bit further. So let me just grab a stick to put in there. Okay, 1 second. Okay, got a little bit of a lollipop stick here, and I'm going to stick this in your mouth. Press down your tongue with it, and I'm just going to look in your mouth. Okay, so open up your mouth for me, please. Very good. Let me just put that there. Excellent. And let's just have a little bit of a look, shall we? Have a look in that mouth of yours. There. Interesting. Okay, interesting. Good coloration. Not excessively red. Got a little bit of an ulcer there, haven't you? A little bit of an ulcer. That's no problem. Just going to put that back in. Sorry. One ulcer, not necessarily a sign of anything terribly wrong. Okay. We all get ulcers from time to time. Could be stress, could be a bad reaction to spicy food. It's not necessarily anything terrible, okay? Okay, that's not bad actually. Not bad, your mouth is looking okay there. Now, what else did I want to do? Just very quickly, please, I want you to swallow for me. Do a big gulp. Good, okay, yeah, I'm just checking that everything is moving correctly as it should be, that you're just able to do things. Okay, basic things. Now I need to check the strength of some of your movements, your nerves, your control over them. Okay, so the first thing I need you to do, I need you to shrug your shoulders. Okay, just do that a few times for me. Very good. Now I'm going to place my hand against your head. You're going to push against it. I'm going to be trying to resist you with some force here. Okay, go on, push. Good. Now the other side as well. Push that side. Good. Okay, now push backwards up against my hand there. Good. Now under your chin, push downwards for me. Push downwards. Very good. Now hold your arms out straight for me, please. Hold your arms out straight for me. I'm going to just hold on to the tops. Push up against my hands. Push. Good. Now push down against my hands. Down. Okay, good. Now try and push outwards against my hands. Okay, push. Okay, good. And now push inwards. Try and squeeze my hands together. Squeeze them together. Okay, good. That's good. You have good strength there. Okay, let me just write that down actually before I forget. Okay, excellent. You're doing very well. I think we've gone through the majority of the test. We do have to look at your hearing ability though. What little tests Do I look like I work for a proper medical institution? Do you think my boss is going to fire me if I hit the patient? No. No. Okay, this is the hood doctor. This is the hood doctor. Okay, keep your eyes closed. Keep your eyes closed. Now, which side of your head is this sound coming from? Was that left or right? Good. Let's try that again. Left or right? Good. 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 Okay, excellent job. Let me see. What was the next one? Keep your eyes closed. Keep your eyes closed. Did I say you could open your eyes? No. Okay, keep them closed. Now, I'm going to make a sound. I'm going to move the sound further and further away from you. And I need you to tell me, please. I need you to tell me when you can no longer hear it, okay? Here we go. Tell me when you can no longer hear this sound. Okay, good. Now we're going to do the one ear. Good. Okay, now the other ear. Good. Okay, excellent job, I do believe. Keep your eyes closed. Keep them closed. I need to use a little tool to make a little sound. I'm going to make two sounds, and you're going to tell me which sound is closer to your head, one or two. Okay, so keep your eyes closed. Here we go. Which sound was closer to you, one or two? Two. Good. Good. One or two. 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 Good. Very good. Well done there. Okay, now the final thing I need you to do, I guess you can open your eyes for this, that's okay. I need you to repeat back to me some words that I'm going to whisper into your ear, okay? Now then, let's do a little whisper, shall we? A little whisper. Now then. Gang violence. What did I just say then? What did I just say then? Gang violence. Right, correct. Very good. Menace. What did I just say then? That might be a difficult one for you. Menace. Yes, good, good, good. Incarceration. What did I just say then? What did I just say then? Incarceration. Correct, correct. Asbo. What did I just say then? What did I just say then? Asbo. Correct. Okay, that's enough. Okay, I believe everything is good. Let me just consult my notes. Let me just double check, because maybe I forgot that you performed badly at something, but I don't think so. Okay, let's see here. That's perfect. That's also good. Good. take that as a win, my brother, okay? Because, you know, we live in a crazy world. Crazy stuff happens, and we need to look after our little brain cells as best we can. Very easy to just destroy all our brain cells. And now, I'd be drinking, I'd be taking drugs, I'd be getting hit in the head all the time. I'd be losing brain cells left, right, and center. It's a wonder that we're still even capable of communicating and doing basic things, you know. Dangerous life that we lead. But your health is perfect. After my cranial nerve exam today, perfect health, well done. Okay, so if you could just give me the little bit of the monies that you owe. Last time you gave me 100, maybe you could give me 100 again. 100 again. Okay, very good. Thank you so much. I take that then. Right. Well, if you're happy, I'm happy. You have any questions for me? No questions. Okay, that's excellent. There we go then. That concludes our hood doctor appointment today, and perhaps I'll see you again in the future. Remember, you can always come back to me. You can rely on me. You know what I'm saying? I do that good stuff, baby.